here we are at the Morita Soaric unit, and just demonstrating how the apex locator is also built into the Morita Soaric unit. As you can see, I have the similar leads I had earlier, and it actually plugs into the chair shoulder of the unit, and you can see the apex locator is on the screen of the Soaric unit, and that works very similar fashion to the smaller equipment that we saw. I'm actually joined here with Leslie, my colleague, who will explain a lot more about the Soaric unit and the ergonomics and what makes Morita so special.
Thanks, Trevor.
One of the philosophies behind the Morita equipment was a design based by a gentleman called Daryl Beach, and he tried to take his philosophy to most of the dental manufacturers around the world, and not many of them would buy into it, but Morita did buy into his philosophy. And his philosophy was that you should always sit and operate at 12 o'clock, the patient's head at heart height, the light vertically above the head, and all your instruments should be able to be reached by using just your forearms, so that you are not putting any stresses or strains on your shoulder joints or your back. So you could operate, and without taking your eyes off the patient, who's your main primary care, you could operate. The early Morita units had their instruments coming out of the back of the chair, and were very popular in New Zealand in the 70s and the 80s, but it wasn't a very hygienic design. So this is German design, made in Japan, handmade to order, 3 months delivery, but it is probably one of the best units in the world. It's won some amazing international design awards, and the philosophy is Daryl Beach.
Right. So this is not just about patient comfort. It's really also about the practitioner, and you know, because long hours in the office, and how they can actually reduce those stresses.
Most dentists think that the patient's comfort is more important than theirs. They always lie in a chair and say, "Oh, this is that or that." My contra to that is, you're here 8 hours a day, they're there maybe an hour, half an hour, 2 hours, once every year, once every 2 years. But it's what you sit on, how you sit, allows you to practice good dentistry for 20 or 30 years.
Right. So longevity is really a big thing here, isn't it?
And longevity of the operator, protecting their back, protecting their neck, protecting their physique, so that ergonomically a dental unit would deliver excellent operating posture.
Right. And the finishing, this is traditional Morita quality. I see everything here is just, there's really been no expense spared in the design and the thoughts.
Handmade, hand polished, hand buffed, made to order.
So it looks like when you come in here, there's obviously been designed smooth operation, chair, obviously multiple positions. I see there's some settings there where if you have different people using the chair, they can set their preferences.
So if we go back to our home, we can choose 4 different operating positions for 4 different dentists.
It's great when it's a shared environment.
It's perfect. If you've got a practice where 4 different dentists work, perfect unit.
Right. Lovely. Well, thanks, Leslie. I appreciate your time.
Pleasure.